Mollie James. I'm going to walk you through a sample Quest lab review. This one is a patient who's been with us for a couple of years now, so you can see some progress as we walk through the report. So we start with the G6PD. This is an enzyme that the body needs to use things like IV vitamin C or ozone. This patient's in the normal range. Homocysteine is an amino acid that gets recycled by B vitamins. Again, this patient is in the optimal range, and I believe that was improvement over time. Next is the comprehensive metabolic panel. So this is looking at kidney and liver function. It's also looking at the fasting glucose. So in this instance, the fasting glucose is 97. We like to see that 70 to 85. So this is a little bit on the high side. The BUN and creatinine is the kidney filtering function. Again, that creatinine is a little in the low end of things, maybe because of loss of some muscle mass here or inactivity. So we might be thinking of things like creatine to support that, increasing muscle mass, resistance training. It also can be with overhydration. The EGFR, this is the estimated glomerular filtration rate, is excellent. The BUN to creatinine ratio is high, mostly because the creatinine is low. We have a lot of patients who have a high ratio as well because their BUN is up. We have a lot of patients who are doing a high protein diet, and that tends to make that BUN higher due to the nitrogen metabolism. Next, we look at the electrolytes. Sodium, potassium, chloride, CO2, and calcium are all in the normal range. We see the kidney or the liver synthetic functions here. So the liver makes proteins. It looks like it's doing so very effectively. And the liver filtering functions here, I like the AST and ALT under 20. So this person is in the optimal range. Hemoglobin A1C, this is the average blood sugar over 3 months. You can see this patient is 5.5, and I believe this improved from 6.2. So patient's doing well. Next is the RBC magnesium. So a lot of doctors check a serum magnesium, which is the water part of the blood, checking the magnesium levels over 2 to 3 days. Our RBC magnesium is looking at intracellular magnesium. So this is more a reflection of a 2 to 3 month supply or storage. This level is 5.6. We like it around 6. But I believe this patient was taking a lot of magnesium and it's just not going any higher. So we're not going to continue to just keep increasing the magnesium level indefinitely just to make the numbers look good. Uric acid, this is associated with protein metabolism and tied to gout. So this patient eats a pretty low protein diet, so likely why she's in the low range. Next are the thyroid labs. Generally, we have antibodies. This patient's antibodies have been negative for a while, so we skipped it in this follow-up lab panel. You can see the TSH is less than 2.5, which is where we want it. The free T3 is right at 4.0, so it's in the good range. The reverse T3 is a little higher than I like it. I like it in the bottom third, so 8 to 13. But remember, T3 is the gas pedal of the metabolism. Reverse T3 is the brakes of the metabolism. And that feeds back to the brain. The TSH comes from our pituitary gland, and anything above 2.5 makes me wonder if the body needs more thyroid. So then I would investigate a little bit more and ask questions about the symptoms of low-functioning thyroid, such as being cold, brain fog, fatigue, dry skin, shedding hair, brittle nails, constipation, heavy periods in females, and high cholesterol. So I would look through all of that if the TSH was above 2.5. The SED rate is erythrocyte sedimentation rate. This is a marker of inflammation. The one here is excellent. The CBC, the white blood cell count, is normal at 9.1. The hemoglobin is 13. The patient is not anemic. The red cell indices look good, so this tells us the size and shape of the red blood cells. The platelet count is good at 278. I'm going to look at the neutrophil to lymphocyte ratio. Again, the neutrophils are the guards on the castle wall. If you think of your body as a castle, the neutrophils are the guards on the castle wall. So this is that defends against everything the same way. The lymphocytes are that targeted attack in case there's a breach of the castle. So these are your T cells, your B cells, natural killer cells, antibodies, things like that. So we want to look at that ratio. We want it to be 1-to-1 or 2-to-1. If it's outside of that, then that's a snapshot, and we'll look at the trend over time and see if it is a problem and it suggests anything. The rest of the differential looks good. Next, we look at the B vitamins. So B12 is 764. I like that around 1,000. So maybe increasing that a little bit. The folate is 18.6. I like that between 15 and 25. So the patient's looking pretty good here. Maybe taking a B complex 2 or 3 times a week. The fasting insulin level is 7.2. That is ideal. We like that to be between 5 and 10. Generally, if this is high, I want to make sure, did the patient eat? Sometimes they get the directions incorrect. But if they were fasting and we're looking substantially over 10, that is a sign of severe insulin resistance. And the higher it gets, the worse it is. So we're really going to focus on reversing that, getting the patient metabolically flexible by introducing things like intermittent fasting, low carbohydrate diet, high protein, ordering foods to be less insulinogenic, and just put them on a really good metabolic program. Next is the vitamin D level. This one is 74. Our ideal is 60 to 90 for most of our patients, 80 to 120 if we're dealing with a terrain or cancer issue. So right in target. Next, and this is one thing I like with the Quest labs, is they color code everything for us. So you can see a year ago, 6 months ago, and the current labs. And I'm actually going to scan down a little bit further because they put them literally next to each other for us right here. So the triglycerides, this is tied to the insulin and blood sugar. So you can see it's been pretty stable over a 1 year period. The total cholesterol went up a little bit, not concerning at all to me. The HDL, the good cholesterol, actually has gone up too, which is wonderful. The LDL cholesterol, the quote bad cholesterol, has snuck up just a little bit, and we'll talk more about that when we get into the lipoprotein fractionation. Remember, the heart risk is tied to the HDL to triglyceride ratio, and in this patient, it's excellent. So when we're looking at that LDL cholesterol, remember back here, 96 looks good. So if this is all you checked in the top box, the standard lipid panel, you would think the patient has an increasing problem. But when you look down here at the LDL particle number, when we checked that in November of 24, she had nearly 3,000 particles, and they were very small. So if you look at the progression over time, she's actually substantially better now with her particle number, substantially fewer small LDLs. So we have lost a little bit from the mid-check to now, but still better than we were when we started. Same with the LDL medium. So sometimes what I see is this LDL small dropping as the LDL particles become bigger and healthier. The medium may go up in the meantime. If we look at the HDL large, so we want a lot of those to clean up the blood vessels, and we can see that we're in a good range right there. Lipoprotein little a, LP little a, this is tied to patient's genetics. So you can see in this patient, they're wonderful all the way across. So diet really isn't going to make a big difference for this patient in the LP little a. Apolipoprotein B is the shell or the backbone of the LDL. So as the LDL numbers go up, this also goes up or down. So you can see that did, again, follow the same trend, down and then up slightly again. The hsCRP is the marker of inflammation. So again, C-reactive protein. In this patient, it's gone from 11 to 7 to less than 5. So wonderful progress here. Myeloperoxidase is a marker of vascular inflammation. Again, very substantial progress here. LPPLA2, this is a lipoprotein associated with vascular inflammation, and it's always remained in the good zone. And then OXLDL. I want to go back up here. Nope, that was the myeloperoxidase. Her OXLDL has been good the whole time. So again, LDL is part of the immune system. It absorbs free radicals and becomes oxidized or rusty. So this is kind of a measure of the visual I have is rusty cholesterol balls circulating through your arteries, very damaging. This patient is optimal for that range. So this looks at the peak size, and it's trending in the better overall. So I love this report. It's very visual. It's very helpful for people to understand. I don't always agree with the color assignments, but if you look at the raw numbers and know how to interpret them, I definitely see progress from the first to the last in this patient if there wasn't just a slight uptick from the mid-range viewpoint. So that is review of a follow-up Quest lab. Please drop your questions below.